Do you ever clench your jaw when you're stressed? It's pretty common. Do you ever wake up in the morning and feeling like you've run a marathon with your mouth? Notice tension in your shoulders or a weird ache in your hips or low back after you feel tension in your shoulders? Do you ever wonder if they're connected? Well, they are. You are not imagining that. Your jaw, your shoulders, and your pelvis are intimately connected. And when one is out of place or tends to lock up, they all tend to follow because they're trying to help you. A lot of times it's not very helpful though. So today, let's explore how this triad works and how with somatic healing and awareness, you can gently unlock that calm and that reintegration, releasing that tendency from the inside out where it's apt to stay put. Hello there, Gaias. I'm Dr. Melanie Carlo, and welcome back to Why It Hurts and How to Heal. But before we begin, help a sister, please like the video and subscribe to my channel. And then let me know what's up for you. Do you notice this tension? After you watch this, what do you notice about doing the practices? I would love to hear it. So your body holds tension in patterns, old patterns, chronic holding. They're like a reflex. After you've been injured, everything swoops in to try to protect. And if it doesn't get the message to stop protecting, often there can be a low-level tone of protection that tightens certain areas and it starts to pull you out of alignment. And three key areas, jaw, shoulders, and your pelvis, are all part of the body's stress chain. It's part of that axial skeleton, the center point. When one thing's pulled out, everything tries to work to compensate. Remember, you are designed to be ear over shoulder over hip. So this beautiful spine that we were given as a gift in our birth is designed so the bone above sits and rests on the bone below, but it only does that when you're looking forward, so the eyes are pointing this way, when you have a curve in your neck, a curve out in the thoracic spine, that's the blue part, and a curve back in the lumbar spine, which connects to the sacrum. The sacrum is what lies between the ilia, and that's your pelvis. And when the curve in and the curve out and the curve in are in the right places, your ear is over your shoulder, is over your hip. And then the bone above rests on the bone below. But guess what? Clenching jaws, shoulder injury, back injuries that pull you out of alignment, once one piece is out of alignment, the other ones have to reorganize themselves to try to support you. So that's where uncovering these hidden patterns and working with somatics really can help. So when your jaw clenches, the muscles around the neck and shoulders are bracing. Your breath shortens, even subtly. Your rib cage narrows, and the pelvis tends to tilt or lock. And it's kind of your nervous system's way of saying, brace yourself, something's coming, right? You get triggered. This happens to us not just in our bodies, but psychologically. When you get triggered, there's a bracing, a protection, a pattern. And the more you can notice that, the more you have the facility, you have the flexibility, you have the spaciousness to do something about it. Because here's the problem. Over time, these patterns don't just go away. They don't just settle themselves. They stay wired in the nervous system. And instead of bouncing back to where you were before, your body can get stuck in an on phase. Well, that's where somatic work comes in. Re-educating the brain and the body first to notice and then to let go. So that's why it's so important to do these things slowly. So let me show you something else. When the bones are stacked, ear over shoulder over hip, the weight of the head, which is pretty significant, 8 to 12 pounds in general, it's transferred cleanly into the spine. The bone above sits on the bone below, and the weight of the head is able to sit like blocks on a solid foundation. But when the head drifts forward, the muscles in the back of the neck and the shoulders have to grip to hold it up. The more forward head we have, the more difficult it is for the spine and the back of the body to keep that head from tumbling forward. Did you know every inch your head moves forward, it's like adding 10 pounds of extra weight for your body to hold? It could be like a 60-pound head if it drifts forward enough. So that's when alignment isn't just about posture. It's about releasing, finding and releasing unnecessary tension so the nervous system can calm down, and it's nowhere more important than in the head and neck. I want to show you another important thing. In the neck muscles, and remember we're talking about forward head, where things drift forward and the weight of that head is here. See these red lines? This represents the vertebral artery, which comes up and literally runs in this canal along the side of the spine. The further the head is forward, the more pressure there is on those arteries. And you know what? Those arteries run up through the cranium and into the brain. That's what's represented here. And one of the most stroked arteries where people have strokes is the middle circumflex artery, which comes right out of this canal. How much is our forward head and our straining and our energy to be forward, especially in this culture, have to do with constant stress and pressure in those arteries? It's a very interesting thing to think about. So bringing yourself back into ear over shoulder over hip relaxed alignment and taking the pressure off isn't just about your bones, isn't just about your muscles and feeling better. It's about creating a whole field of more ease and a cerebrovascular environment that everything can just calm down and have less stress. And that is really important. So let's do something I call a triangle release exercise. We're going to try a gentle practice that helps all three areas begin to let go together. We'll do them one by one. You can do this sitting or lying down. It's a great thing to do at night before you go to sleep or when you wake up in the morning. Those two times are the best time to retrain when you're in that quiet state. Okay, so put your fingertips just below your cheekbones, lightly resting on your jaw muscles. This brings more awareness to your face. And now we're going to slowly open the mouth only about an inch and let it softly close. And I'm going to count to 10. So for you to get to that inch is going to be my count of 10, which is very slow. And if one side is working harder or there's a zigzag or a pop, notice and slow down. You don't need to open wide. 1 inch is like 2 fingers. It's not very much, okay? If you notice that there's a deviation, things are moving, slow down even more. Smoothness and slowness matters more than how far you go. When there's deviation, there's likely trigger points. And my next video I'm going to do today, I decided, is going to be about effectively releasing trigger points, especially in the mouth and the jaw area, without having to use medication or see a doctor or PT. You can do this yourself, and it really works. Okay, so now we're going to really work for smooth movement. Hands lightly on your jaw. We're going to open the mouth about an inch. So feel your jaw, feel your face. Breathe into the low back ribs, soften the nervous system, and let's open slowly. 1, 2, very slowly. 3, breathing in the low back. 5, 6, 7, very smoothly. 8, 9, 10. Now just feel what it takes. It's interesting holding your mouth open just an inch with that much awareness. Now smoothly we're going to close. 10, 9, swinging like a hinge, not forcing. 7, 6, 5, floating. 3, 2, 1. Breathing into the low back, let everything relax. And notice how your jaw and your face feel now. You may notice it like feels bigger. Your awareness is greater. You've expanded your neurological presence in your jaw. So I'm not going to do it 3 times now, but I encourage you to do that 3 times. And if you can, do it in front of a mirror so you can get visual feedback and see, are your teeth lined up or are they deviating? Try to keep them straight, okay? So that's the jaw portion. Now we're going to come to the shoulder. Bring your awareness to your shoulders. Feel them in space. Feel how they are in your body. Don't change them. Just notice. Noticing is like a superpower in healing the body when you do somatics. And again, low back rib breathing. Why? Because it increases the body's ability to stay in quiet mode as you work on old triggers, and it really works. All right? So now we're going to shrug again to my count of 10. So breathing gently into the low back, we're going to bring the shoulders up. 1, 2. By 10, you'll be all the way up. 5, 6. Keep going. Breathing low back. 8, 9, 10. Now feel that tension. Feel how it wants to restrict your breathing. Keep breathing deep in the low back. Thank these shoulder protectors. They've worked hard for you. You might be really feeling some fatigue now as you're holding them up. Breathe low back as we slowly go back down. 10. Breathing. 8, 7, 6. Breathe. 5, 4, 3, 2, 1. Let go, let go. Notice what's happened. So again, I want you to do it 3 times. I'm not going to do 3 here, but 3 times. And you should notice there's a softening in the collarbones and the neck. As you totally let go, the breath deepens, the nervous system quiets. Again, your axial skeleton is getting the message, hey, it's okay. All right, your pelvis. I'm going to do a little bit of a yogic practice here, some yoga awareness of Mula Bandha, that lower lock. So pay attention on your sitting bones. Those are the 2 bones at the bottom of our spine. When we stand, our feet are our foundation. When we sit, the sitting bones are our foundation. So feel them. Begin a subtle rocking motion forward and back, just a few centimeters, like a tiny seesaw. And see as you do it, can you hold the upper part of your body still? And maybe you're breathing in and coming forward and breathing out. And breathing in and out. Breathing into the low back. And as you're breathing in and out, imagine your jaw, your shoulders, and your pelvis finding alignment, moving out. Finding alignment, moving out. And you'll start to sense where, in relationship to gravity, your center is. There's an awful lot about finding center here. Now pause, come to the center point, and imagine your sitting bones like 2 thumbs in clay, and push one down, and then the other. And most people notice it's easy to go one way, it's a little harder sometimes to go the other way. Just notice, don't try to change it, but keep breathing in your low back ribs. And gently one way or the other. And don't make it big motions. The softer, the better. And now with a deep breath in the low back, come back to your center. And feel the center of yourself. Ear over shoulder, over hip. Jaw soft. And notice the field of awareness in the center of yourself. It's a really important vessel. Somatic healing doesn't ask you to force release. It invites your whole body to agree to it. This triangle of tension can be deeply wired in how we respond to overwhelm. And when you release it, when you take in practices that help you shift from protect to regulation to calming, you can really affect things like TMJ pain, forward head posture and chronic shoulder tightness, pelvic floor tension and instabilities in the pelvic floor, shallow breathing and everything that comes with that, chronic colds and respiratory infections, emotional regulation and a sense of calm, that heightened sense of anxiety, low back rib breathing, finding your center core can make a huge difference. It isn't just about correcting posture. It's about repatterning a sense of safety and alignment with the world, with nature, so your nervous system can finally relax. You're present to it. So let's think about the bones again. Okay, so we've just done this work. We're in this alignment. When your ear stacks over your shoulder and your shoulder over your hip, the bone sits on the bone above, below. The whole system can start to decompress. Areas of chronic holding can begin to let go. At first, it may not even feel normal. If you're really out of alignment, it feels weird to do it, but trust me, the more you do it and the bones begin to hold your weight up again, the more the body goes, thank gosh, you're finally listening. Your jaw softens, the neck muscles begin to quiet, the pelvis can find neutral instead of tipping forward and back. And the bone-on-bone alignment isn't rigid, it's like fluid. It's alive and constantly shifting and adjusting according to your movement. Like a tree that bends in the wind but stays rooted. If you had a tree that was rooted and didn't move in the wind, it would break. And if you have a tree that doesn't have deep roots and the wind moves it, the whole thing flops over. So finding your rootedness and then finding your resilience, that's the state where your body feels its safest. You know, in the wild, animals naturally restore this state of inner tranquility, inner alignment, especially after they've had a stress, like they've been chased by a lion, let's say an impala, and it gets away. You'll see that animal shake and breathe, and move, and get out all the cortisol and the epinephrine and the things that build up that cause the tension until calm returns. And then it goes back to eating grass like nothing happened. But as humans, we have, better or for worse, we can override that process. But because of our separation from nature, often our separation from ourselves, we don't know how to actually regulate and re-enter into that state of alignment. And so we stay clenched, very much especially in the jaws, shoulders, and hips. And this clenching can last for years. The protector's there. But when you give it a voice and notice it and give it the opportunity to release, giving it space and permission, your body knows how to do it. Your jaw, your shoulders, and your pelvis form like a triangle of tension. And somatic healing can help you soften all three from the inside out. So let's integrate it, put it together. Soft jaw, smooth swing. Shoulders rising and falling with breath very slowly. Pelvis rocking and side to side like a circular seesaw. And now if you pause and you sense what we just did, notice ear over shoulder over hip. And can you just feel or even imagine how when the bones are lined up, the muscles can let go, the ligaments can soften? Just stay in that place for a few breaths. Feel supported. Feel how your body's actually conspiring to support you. The protector's just trying to do the best it can, and until you see it and release it, it's afraid to let go. Feeling supported back into alignment, not held, everything begins to relax. So try this release anytime you feel wound up or stiff, when you notice your shoulders are up around your ears, or you're grinding your jaw again. Did one area maybe feel harder to relax than the others? That's not uncommon. But working them all together helps them all realize that their connectedness is to their benefit. Ease one, help ease them all. Share your experience in the comments. I'd love to hear. And please don't forget to like and subscribe, and I'll keep on going with body-based tools for healing. The next one, I want to explore trigger point release. Really powerful techniques to get rid of those tensions and those pains that you can feel on your own. Until then, go gently, my Gaias. Your body's always listening. Be kind and compassionate.